Hi, I'm Dr. Lakshmi. I'm a plastic surgeon from Hyderabad. I have completed my MCH plastic surgery from Gandhi Medical College, Hyderabad. Tamira Shiksha program is an exclusive aesthetic training program with IAPS accreditation. Training involves a non-surgical and surgical basic to advanced training program.
Hi, I'm Dr. Shri Girish. I'm basically from Tirupur. I've completed my plastic surgery training from Stanley Medical College, Chennai.
Hi, I am Dr. Shubhra Samant from Kolkata, West Bengal. I passed my MCH plastic surgery in 2019 from IPGMER and SSKM Government Hospital.
I joined the Tamira Fellowship for the aesthetic surgery training, and I joined the fellowship in January, and almost 6 months of fellowship is over for me.
Coming from a government college, we have minimal exposure to these kind of procedures. So I was searching for a proper cosmetic surgery procedure training, and I found that most of these training programs, they offer just observership.
I wanted a fellowship of international standards, and I want to get exposed to both the non-surgical and the surgical procedures. What I have learned, like surgical part, non-surgical part, business management, client handling, and also how to approach when you look for a job. Everything has been discussed.
Before coming here, I used to get a lot of queries regarding various cosmetic procedures, particularly breast augmentation, gynecomastia, hair transplant.
Body contouring surgeries, abdominoplasty, breast reductions, augmentations, rhinoplasty, genital rejuvenation procedures, and blepharoplasties. Apart from the surgical procedures, we have got experience on non-surgical procedures like Botox, fillers, thread lifts, peels, lasers for hair removal.
The laser keloid treatments and followed by radiotherapy, and also the Morpheus 8 we have, so radio frequency assisted body lipolysis, and also the facial skin resurfacing.
Here we did workshop of fillers, Botox and thread lift. So we are now confident in doing all these non-surgical procedures independently. Here we are exposed to all the latest technologies like ultrasound assisted liposuction, radio frequency assisted liposuction and power assisted liposuction, and we got using all this technology for body contouring procedures.
I have got to experience the state-of-the-art technology like Vaser, Micro-Air, Body Tight by Embrace RF. During my training period, I have got to observe various clinical cases in the outpatient department, various skin and hair disorders, the planning of the case, and how to choose a plan for a particular surgery, and how to deal with the difficult patients, and how to manage the complications or how to avoid the complications.
One factor which I find it was very useful for me is we get to see patients in the OP when madam is discussing about the patient or explaining to the patient. In some patients we might need to take history and explain about all the procedures, everything, and then we go and discuss with the madam so that we get a clear idea about how the patient management, talking to a patient and convincing the patient. So I don't know how many fellowships offer the fellows to come and sit inside OP, but madam is very kind enough to do that.
Apart from the medical aspects of the healthcare, I have got to learn the business aspects of the healthcare. I can confidently say that this fellowship program has helped me in improvement of my skills and be a better aesthetic surgeon.
After the 6 months of fellowship, now I am confident in consulting the patients for cosmetic procedures, and also can perform these procedures independently and even can manage the complications. My advice to the future fellows is, if you are opting for a fellowship in India, then this center is the best center for all surgical and non-surgical procedures. You will get enough exposure to all these kind of procedures, and with hands-on also, and that too in a short term of 6 months.
I would like to recommend this program for my plastic surgery colleagues, as it is an integrated basic to advanced aesthetic program, and to be the best, we have to learn from the best.
So advice for the next joining fellows is So you have to dedicate 6 months time for this fellowship. So it is a residential fellowship. So you have to be here. You have to dedicate your 6 months time. That you have to prepare and come for and apply for the fellowship. Next, your exposure will be completely from non-surgical to the surgical. It will be there. You need not worry about the exposure. There will be exposure, and it will be an eye opener for you.
I have taken guidance from ma'am regarding opening and running a cosmetic center in Kolkata. So, hoping for the best.
My future aim is to start an independent aesthetic surgery practice. Finally, I would like to conclude that I am happy to be associated with Tamira Life.
Now, actually, I am very keen in practicing the aesthetic surgery and all the surgical and the non-surgical when I go back to Coimbatore.